Is being recorded.
I want to thank everybody while I struggle with technical issues. All right, let me do a check with my team. Do you see the main screen now? Slide? And I'm seeing nodding. Excellent. Thank you everyone for your patience. We are using a different technology for today's learning community meeting, and we do expect many people to join us today. Can I do a check, Tiara or Sarah? How many we have joined so far?
Denise, we have 47 participants right now.
Great. We're going to give it one more minute, folks. We had over 100 people register for today's discussion, and we want to give them time to log on, especially if they were experiencing technology difficulties like myself. So we'll give it a moment. Sarah, what do our numbers look like?
We have 60 folks joining us.
Okay, let's start. I think by the time we get through the introductions and into the substance of the discussion, others will join us. So thank you everybody for joining us today. We know that these are challenging times for all of you. We truly hope that you and your loved ones are safe and healthy. This is a Systemic Care Leadership Learning Community. Beth Struhl and I host this learning community, and today's is a special discussion, particularly on communication during a crisis. We want to welcome you to this discussion. We'll talk about best practices for how, what, and when to communicate to your community. Because this is a different and special session and more of a discussion, we will not have a PowerPoint presentation. Our experts will engage you in discussion, and there will be a question and answer period at the end that will be moderated by Anita Bryant. In addition to today's discussion, we're going to have another one take place on Tuesday, March 31st. And Anita is going to put the link for that to register for that discussion in the chat box. We also want you to know that TA Network, we've been working hard this past week to pull together resources for you that can support you in other elements as you deal with and adjust to daily COVID-19 mitigation efforts. So one of the resources we have for you, and we'll post this in the chat box as well, is the National Wraparound Implementation Center and the National Wraparound Initiative, Prepare to Report, with guidance on potential modifications that may be necessary to effectively support young people and families participating in Wraparound during COVID-19. And Anita will post that resource in the chat box. Similarly, we produced a discussion on key elements of focus, which is an intermediate care coordination model, and potential modifications needed for families and children during COVID-19. And we'll post that resource in the chat box as well. We are also working on a state-by-state guide. We've gathered a scan of all states to see what they've done with regard to telehealth and Medicaid expansion efforts in light of COVID-19. We will be posting an interactive map on our website in the coming days, and we'll be sure to notify you once that is up. In addition to that interactive map with telehealth expansions, we will also be posting different federal guidance that has been coming out to support you in your efforts, including guidance that came out from SAMHSA today for grantees on flexibility for grantees that are affected by the loss of operational capacity or increased costs due to the COVID crisis. And Anita will put that link in the box as well for you. So today's discussion is going to be led by Michelle Boardman. She's the Director of Social Marketing at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. And she's also a subject matter expert for the TA Network on communications. Michelle is joined by Liz Manley. Many of you know Liz. She is the lead consultant for many sites as part of the TA Network. She is also the lead for the TA Network on our clinical best practices and workforce development work. And Liz is also at the Institute at the University of Maryland. She is a clinical instructor for behavioral health and policy. So with that, I am going to look at that. I didn't move to my second slide for all of you. There's their contact information. We do want to remind you that the TA Network is here for you. Continue to reach out to us. And with that, I'm going to move the discussion over to our presenters. Please do use the chat box as you're used to post questions. Anita Bryant is going to be monitoring that chat box. We will make sure that all of your questions are addressed at the very end. And due to the number of folks that we have on the line, we are not going to be opening up the lines. You will be muted, but we will make sure that we get back and address your questions through the chat box. So thank you very much. And I'm going to turn it over to Michelle.
Thank you, Denise, and thank you for joining us today. I want to start by thanking my colleague Liz Manley for joining me today. Liz has great experience to share with us. She was the Assistant Commissioner for New Jersey's Children's System of Care during Superstorm Sandy, and she has some great experience to share with us. So I'm going to kick us off, and during the presentation, I'll turn it over to Liz a couple of times. And I also want to thank my colleagues, Anita Bryant, our lead social marketing specialist, and Sarah Warner, our program coordinator, who are both have jumped in and helped us create today's conversation. So with that, I want to start by acknowledging the current situation. We're in a very challenging time. I know that it's challenging for you. It's challenging for me too. It's challenging for the organizations that we partner with and for our communities. And central to today's conversation, it's a challenging time and a scary time for the families and youth that we serve. I've heard of the coronavirus described as 5 crises in one: a public health crisis, a business crisis affecting the operations of all organizations, including our organizations serving families and youth across the country, a worldwide economic crisis, a social crisis requiring different ways of living in the world for all of us, and an information crisis. And it's this last crisis, a communications crisis, that we're here to talk about today. Right now, we're bombarded with information. As I'm sure you know, the volume of communications coming at us has increased exponentially over the past weeks, and it shows no signs of abating. We have information fatigue. Some of the information we're receiving is misleading, is incomplete, is inaccurate. Some of us are paralyzed into silence. We're all trying to answer the question, what public-facing communications are required of us and of our organizations at this time? We're all facing the same situation. And I apologize, I'm just getting over a cold. So I apologize for that. The reason we scheduled today's call with you is to provide some clarity and some thinking with you around the fact that you have a role to play and your communications have a role to play in supporting families and youth through this crisis. Our goal is to provide a framework for thinking about and acting on your communications, and to provide 5 essential tips to keep in mind for crisis communications around children's services during the current time. In some respects, the process of communicating with your audience during a crisis, such as the current one, is no different than the process of communicating in normal times, except that the workflow can be far more rapidly paced. And what I mean by this, that the process of communication doesn't change, is that we guide people here at the Today Network through our technical assistance to develop a social marketing goal that supports your overall project or organizational goal. Then to accomplish that social marketing goal by thinking through who your audience is, what you want to say to them, and what they need to hear, and crafting a message based on all of that information. We talk about pushing out this message through the channels that are most likely to reach your audience. So for example, if you're talking to youth, social media will be one of your key channels, and to monitor the results and adjust accordingly. This basic process of developing audience-informed communications does not change during a time of crisis. Everything that you already know about how to communicate with your audience is as relevant today as it was a week ago. You already have the skill and the ability to communicate with your audience during this crisis. I know you do. But what does change is the content of what you are saying. And it changes because the people that you care about, the people that you serve, need to know that you are here and that you care. You don't have to have all the answers in a crisis. I know you don't have all the answers right now, and neither do I. But a clear, persistently communicated demonstration that you care is necessary for as long as this crisis continues. Silence is not an option in a crisis, because silence is interpreted as indifference. You want your audience to trust your organization, to see you as a source of information, of resources, of community. And the longer you allow silence to continue, the harder it will be after the crisis to rebuild trust and community, because you didn't come through when you were needed most. If you don't know what to say, if you don't have all the answers that you wish you had right now, put out a carefully crafted standby message that, in your own words, communicates that you care, that you're trying to figure it out, and that you'll be in touch. Talk about your approach. For example, we're working with local health authorities to, and you can think about content of your communications during a crisis as being one of 2 types. Some of your communications right now are going to be an even more essential part of meeting your organizational goals. And some of your communications will skip straight to what your audience needs to hear from you in terms of information and resources, and may not be closely related to your organizational goals. We're going to talk briefly through each of these 2 types of communications to give you a framework for considering communications during the current challenging times. And then we're going to talk about 5 essential things to keep in mind regarding communications during COVID-19, and then open it up for questions. I think Liz and I, will speak probably no longer than 20 minutes because we really want a chance to answer any questions that you have right now. So first, communications that are an essential part of your organizational goals right now. Let's make this concrete with an example. So perhaps one of your organizational goals, as it is for several of our systems of care, is to increase access to mental health services for children, youth, and families. Perhaps you've determined that one of your related communication goals in support of that organizational goal is to launch a social marketing campaign to reduce stigma. What the current crisis means for your communications is that you might still put out content that can help reduce stigma, but it's no longer the primary focus of your communications. The primary focus of your communications should still be around your original organizational goal of access to mental health services for youth and families, but it will be about how they get access right now when a lot of services are closed, when the government is limiting our face-to-face contact, when transportation systems are down. As your organization and community makes decisions around access, your audience needs to know that you're there, that you care, and that services are available. Your communications serve to answer the question, how do they get access? Your communications by necessity become a literal nuts and bolts information providing essential function. But it's very much in support of your organizational goal. Your audience will maybe stay the same in terms of size or get broader because more people will need the information that you're sharing. But what you know about them is still relevant to keep in mind while you're formulating communications. In regard to your previously established communications plans, your goal of reducing stigma, before disseminating those communications, consider how they will land with your audience right now and how it will impact your brand. Will you appear tone deaf by putting them out right now? Because they will feel unrelated to the current crisis, which is at the top of everyone's mind. Will they have the result that you intended, or will they just get lost in the avalanche of COVID-19 communications? And then the second kind of communications that we wanted to outline in this framework is communications that are focused on what your audience needs to hear from you right now. And they may not neatly align with your pre-existing organizational goals. Liz, I'm going to turn it over to you.
All right, thank you, Michelle. So the first thing I think that's really important is in communication is we really need to be clear about who we're talking to. And with that, we need to make sure that we are connecting for every group and community that we need to connect to. So we need to think about who is our highest priority to get to? How do we get there? What will that look like? We use our websites to get there, and don't let our audience have to find the information, right? We really want to be focused on how to get the information right to the top of their list, to the top of the place that they're going to look for it. We want to really think about how to connect through online conversations and bringing communities together and making sure that those communities have the ability to share information quickly with other communities as well. So we want to bring in community leaders, and we want to talk with our youth, our families, our partners, our strategic partners in this work, and we want to fill the void. We want to make sure that we have worked really hard to make sure that there's no absence of where people have to sit with the anxiety that comes with what they're experiencing right now. So where do we start? We start with empathy. We use our value-based language. We use system of care language to demonstrate caring, to talk about safety and health as our top priority, to acknowledge their challenges and the challenges that people are facing right now, and what we can do to help and to support them. We use straightforward language that doesn't allow us to get to words like, as many people listening know, I'm a big fan of language, and we don't want to expand things into language that's going to really scare people, like pandemic and epidemic and emergency and crisis and the worldwide public health emergency, disasters. We want to use language during this time that help people just really focus clearly, that we're all on the same page. COVID-19 works because it helps people understand exactly what you're speaking about. We want to steer clear of all of those scary images that folks might have, and we don't want to sensationalize this, even though in this world we're going to feel that too, right? As the workers and the leaders within this work, we're going to feel some of the anxiety that are the individuals that we're trying to communicate with are experiencing as well. But we have to manage the expectations with transparency. We don't want to say this is going to be okay. We want to say that we're going to work through this together. We want to work together on this. And I just want to say that in the world of Superstorm Sandy, when everything was very scary in New Jersey, things like no power and houses were drifting out in the ocean. And, I mean, the whole world felt like it was falling apart during Superstorm Sandy. We had no gas, and I was in a new job that required me to travel an hour and a half. And I was trying to figure out how I was going to get there and get back because I couldn't get gas. What I realized during that period of time was that I had to manage my own anxiety around the things that were really important for me and for my family to ensure that we were safe, with the idea that we had to communicate in the larger presence about what was going on and help other people feel safe. And so we worked through those anxiety points for ourselves by putting together a group of people that we could share and talk about our own stuff with, right? We sought out our thought partners in this work to make sure that we were all taken care of. So we have to take care of ourselves so that we can take care of others. Okay, so we also want to make sure that as we're communicating, we're using really trusted resources, right? That we're really clear about those trusted resources, and we're providing information that we know is accurate and true, at least even in the moment, because some of this is really moving fast. And so we want to make sure we get the most up-to-date information out, but it's all going to be from trusted places. Don't hesitate to communicate, right? We want to resist the impulse to wait until you know more. We want to communicate what we know, and we want to communicate it in a way that makes sense. And we want to use your channels for broader audience to make sure that the information gets to people who need to have it. We want to develop new channels that are needed now and be responsive to comments and questions. It's really important during this time for us to think about moving forward too. We could get stuck right now and be stuck in the moment of what we have to do in the day-to-day. But unfortunately, this is a time for us to also think about moving forward and what's going to happen later, and what the wave looks like when people begin to be feeling better physically. What happens then to their emotional needs? And so the situation is fluid, but it's going to change, and we need to both have a foot in the door right now of what we need to worry about, but also be thinking about what the future is going to look like. And I think about this time now as a time to innovate and think about innovations that are both going to be helpful in the short term to get to the places that we need to go, and helpful in the long term in terms of our ability to continue to meet the needs of youth and families. And we start at the beginning. So I always start with system of care. The system of care allows us to understand what the values are and where we're going to put our resources and how we're going to think about the decisions we have to make. System of care was the driving framework for our ability to meet the needs of youth and families during Superstorm Sandy, and it continues to be the driving framework for change that helps us move forward. We want to implement continuous quality improvement strategies, really to assess how things are going and what is working, where the challenges are, and what do we need to change. And we want to do that on a really very regular basis, ongoing basis. What's working, what's not working, what do we need to change? Is it important for us to change this because it's impacting one family, is important to changes because it's impacting a larger number of families. We want to prepare for the next step. Each step in the process will require an attentiveness to what youth and families need in order to address their increased stressors. And we want to really be attentive to those stressors, both the stressors of are families working, are they able to get the resources that they need to ensure that their children are taken care of, and also the social disconnectedness that this could bring because we're not able to actually be in the same space. We want to prepare for post-COVID-19 challenges that youth and families face as they return to work and school. And there are going to be a lot of those challenges around returning to school and returning to work. Life is going to look really different and challenging for children. It's going to be anxiety provoking for a lot of folks. And we really want to be prepared for that. And we want to create opportunities now to communicate with folks on where to go and how to access help when they need it at the time they need it. Be prepared to address the needs of youth and families who have experienced loss of a family or a friend during this period of time. There's going to be delayed response around those losses that are really important for us to consider. And we want to focus on what we can do to help families to recover. All of this, there are things we can do, and we should do that. There are things that are important for us to do right now, and what do we have the ability to control? What do we not have the ability to control in this? Think outside the box. What you are learning today can really help change the future of the way that we work with children and families. And those innovations are important for us to pay attention to see how they work, to see if they were taken well, did families really think that they were good innovations, and feedback around those innovations are really important. I mean, the most clear one is certainly on the use of telehealth technology and moving into children's homes to provide them care. Is this a good thing for folks in the long term? And in what conditions is it a good thing? And what data do we know about that now and later? And then we want to connect leaders and communicators. Communicators should be brought into leadership meetings where organizational direction and decisions are made during a time of crisis. Make sure that they hear firsthand and develop appropriate messaging and channels for that. Communication plans and direction should be shared with leadership. A unified organizational voice is needed now more than ever. And let's be clear, we want to make sure everyone knows what's going on. And I've said this before, when things are going really well, we have to communicate. When things are going, when things are challenging, we have to do that even more often. And we have to make sure not only do people understand you in the moment, that they understand you later too, because when folks are experiencing challenges, it's difficult for them to hear the full message, and we need to be patient in the process of communication. We need to involve our social marketing committee and existing communications folks working in groups. Share your plans, ask for help in disseminating that information, and share with your team the focus on communications and level of effort required by the team. And designate an editor. Remember, you're moving fast. Remember, you're moving very fast, so make sure that people can check and correct. Be clear with your language and be clear who you're communicating with. And I think together we will all move forward. All right, Michelle.
Liz, that was fantastic. Thank you. You did such a good job of kind of weaving in some of your experience with the tips that are in the sheet. And I really had some aha moments when you were talking about this idea that, you know, there are certain things that are happening now that will cause triggers in kids, and experiences that they're having where there is loss, but yet we're not able to go to wakes or funerals the way we might normally. And to anticipate those needs amongst youth and families and get prepared to address them. I think that's a really great example of how we need to be forward thinking in our communications.
Absolutely. And I think that, and I just want to make sure that you understand that the anniversaries now will trigger not just a smaller response, there'll be a bigger response, right? The anniversary of death and loss will be bigger because of our inability to work through together as communities in terms of those losses.
Thank you. And now we're going to turn it over to Anita, who is monitoring the chat box. And we welcome your questions. Please let us know how we can help.
Thank you, everyone. I'm just here to hear, if you have any questions, please put them in the chat box. We're waiting now just to give everyone some time to get their thoughts and get all the information together. I don't know if you guys want to start off, Michelle or Liz, with any more information while people are submitting some questions.
Liz, could you talk a little bit more about how you addressed communications during Superstorm Sandy? And the kind of how many people or the number of people, kind of how your audience were on during that time?
Yeah, I mean, I think what's interesting about what's happening for us now is we do have the ability to communicate, right? We have power, we have electricity, we have, the telecommunications tools that are available to us. During Sandy, we didn't have any of those. All of the communications were knocked out for a good portion of the state, and you could not talk to people on cell phones. As an example, there was no cell towers, and landlines were struggling. There was no power. Most people in the state were without power for a good amount of time. And so we had to really think about how do you communicate with each other and who do we need to get to first. We were able to text message. That was new technology for us. The state didn't even allow us to use technology, but we used it anyway to get in touch with and find. And the first thing we needed to do was to find people, right? Make sure that everyone was safe. Are you all safe? Do you have what you need in order to hunker down until we could get more things moving? And that was our first play. As the power came back on, I was one of the first people to get power back, which was really made me the center of communications that went out. We prepared a communication message for each group that had the same information, but really focused on who we're trying to get that information to. So as an example, we focused on some of our communications needed to get to foster parents and make sure that foster parents were clear about how to get their payments, right? We had to secure payments to foster parents. So we needed to get to those. We needed to get to the youth themselves and make sure that they knew how to reach out to the people that were on their teams, right? That they could communicate with care managers, or we had to get to people who would experience a crisis to make sure that they didn't end up in an emergency department, which is particularly important right now, that we get to people before they ever think about bringing their child who might be experiencing behavioral challenge. We don't want those children to go to emergency departments. We generally don't want them to go to emergency departments, but we particularly don't want children in hospitals right now. And so how do we get to those families to get a message to them that says, what's the alternative? What can you do instead? Where can we go? So as an example, in the states and communities that have mobile response teams, we want to heavily communicate to communities that mobile response is available and what it looks like. Are they going to actually come to your home? Are they going to beam into your home through using some telehealth technology? What is it that's going to happen in order for families that are experiencing crisis? So we want to actually get there. Some of those tools we used in Superstorm Sandy was very helpful in keeping children out of emergency departments, which was also challenging at the time. So that's some of the strategies we used. Our goal was to make a list of the people that we needed to get to and figure out what is the way they're going to get that message. Communications. We used a lot of our community partners to get messages out. We knew that our families would touch on pediatricians. We knew they would touch on schools. We knew that they would touch on our religious communities. We went to those religious communities, and we actually got pop-up sites into communities so that people could find out information. We were handing out flyers, and we actually had helpers around for folks to go to. So those are the kind of things that we want to think about.
Oh, and that's great. Oh, sorry, Michelle.
Go ahead, Anita.
No, I was just saying, because that was one of our questions, was to actually reach families that are overwhelmed and are facing the new norm. And what did you recommend? So you actually answered that question that just came in about how to reach those families when you don't have those means of communication that we normally have, and to reach out and, touch them. So thank you so much.
I think one of the other strategies is use our parent partners wherever they are across the country. Use our parent partners to communicate with families.
Great.
And to make it easy for people as well to find the resources that they need. So, be a hub, or if there is already an information hub in your community, if one of your partners is gathering resources and putting them on their website, work with that. Ask them to add some additional resources and point people in that direction. But think about how much information is facing youth and families right now, and how can you make it easy for them? Don't leave them to sift through all of the information and find what they need. Or consider convening people online, pulling together your partners and other community members in a forum like this.
Mm-hmm. And that seems to be two of the questions that have come in, is the type of communication used during this time and this time of crisis, and the examples that you guys have displayed. We're still waiting for some more questions to come in. I don't know if you guys want to add to that. That seems to be at the top of the list, is just kind of getting the outreach out and staying connected. Mm-hmm. And especially now, and I think that was a great a tip you made of utilizing your partners and how you utilize your partners, because they have that direct connection sometimes when you don't have that outreach or that resource to send out the information. So we're just waiting for some more questions to come in. But if you guys want to chime in, oh, sorry.
Me, so I could see two more questions. Peggy was asking about the 5 tips. And so we did repost those 5 essential tips in the chat box. I don't know if you have additional examples for each one, or maybe in light of Sandy, some applications of each tip that you'd like to share.
Sure, I'll go through them again and I'll make sure I highlight them. So
great.
So number 1, be a connector, right? And so the way to be a connector is you want to understand who it is you're trying to get your message to, and develop a game plan for each one of those groups of people you're trying to get your message to youth, to families, to partners, community partners. You want, for me, when I was working at the state of New Jersey, I also had state partners I needed to communicate with. I needed to make sure that I was touching base with our licensing folks and with our, the institutional abuse folks and our partners at child welfare and juvenile justice and our hospitals and outpatients. And so we had a way of putting all that together. But my goal was to connect with all of them and to find avenues to connect with those folks. And that's what you really want to be thinking about. How do I get to them? How do they see me? Even if I can't be present in all of those places, how do they actually know that we're still here and working? So 1, be a connector. 2, begin with empathy and really make sure that people understand that you're standing with them, and that systemic care language and values is really helpful driver around empathy. It didn't hurt that we were all in the boat together in trying to figure out how we were going to help each other during a time of real panic and concern around supplies and gas and power and electricity. And it certainly didn't hurt that most of us were in the same boat. We didn't have power as well, but we were out there using it. So use empathy to help. 3, don't hesitate. Just make sure you're moving forward, getting to people, connecting as much as you can, and really finding ways to communicate. So don't wait. Don't wait for that to happen. Don't wait to have all the information or all the facts, right? You want to communicate what you know and what you don't know clearly. And you can say, I don't know. We're still trying to figure that out. We're not sure how this is going to work, but we're going to go through this together. One of the things that was helpful for us during Superstorm Sandy also was we said, we need your help in trying to figure out how to get some of this up and running. So we talked to families about some of this. We talked to some of our partners who were in communities to say, what is going to be helpful, because we don't necessarily know all the answers. So don't hesitate, because this is a time for us all to learn together. And I think it's going to be really helpful. Some of the valuable lessons that you learned, they certainly were from me. 4, remain.
And I have,
go ahead.
Oh, I have a question from Dylan. And Dylan wanted to ask you, Liz, what were some forms of communication you discovered, as in something not used before in the crisis, that worked best when navigating the Sandy crisis?
Sure. There are three things that we did in New Jersey that I think were really helpful. Not all of them will be helpful today because of some of the rules around social distancing. But one of the first things we learned we needed to do was I needed to be in the community. People needed to see me, and so I came up with this thing where we called it Meet the Director, where I went to every community and I presented and talked to people who had questions, concerns about how what was happening and how we could be helpful. So that was a really important, valuable tool that we actually included in the toolbox for us moving forward. And I did those kind of meet and greet kind of type meetings for a long time. They can be done virtually, but I actually traveled the state to get to see everybody. Two, we put together a web-based resource program so that people could find resources on a regular basis called ResourceNet in New Jersey. And so they're statewide, so people can go there and get information that's really important. So it's a way of communicating on a pretty regular basis with folks.
And a great example of being a hub.
Yes. And three, we actually made sure that in the work, we highlighted our partners and our partners' work. So we worked with our counties to create the ability to get to all of their own partners in the community quickly. So we worked with them on that strategy. So those were our three quick strategies that we put in place pretty quickly.
And then there was another question. Are there any recommendations for reaching out to families that don't have access to a phone or internet? That came from Michelle Pittman.
Sure. So that's challenging, right? And it's challenging because how do you engage with families that you're not sure they want to engage with you, right? So that's the first thing. And I think that's where using trusted folks within communities can be really helpful. So having the ability to connect with those religious organizations, to connect with like places like the informal places like YMCAs and which don't necessarily and aren't necessarily open and running now, but there's still people within those communities that can be helpful because they have mailing lists, because they know how to sort of get to some of these folks. And so you might want to reach out to some of those community leaders and put your head together around how can we get messages out to people who aren't coming forward. I would definitely think about the schools. I don't know what the schools look like in your communities. In some of the communities in New Jersey and certainly in communities in New York, they're still serving lunch for students and they're still sending homework home. They're beaming out information into the children's homes. And so you may want to think about trying to get a message to the schools so that they can help deliver it to families about how you can be helpful. This is just a couple of thoughts that I have.
Yeah, and I would add to that, definitely, think about grocery stores, which are open, and convenience stores, messaging around that, paper signage, as well as religious leaders in your community, because they are trying to find ways to connect with people in their constituency.
Right. So we have another one from Daniela. As a network of care manager, being the support for the regional systems of care, how to be better at sharing crucial information that comes from different sources without duplicating or oversharing the same information, so that it doesn't become overwhelming to your staff in particular and to the people that you're servicing.
Mm-hmm. So this is actually a time of over communication. So I wouldn't worry about over communicating with people, but duplication is something that you should worry about. So I would say if people are posting things in other places or other organizations are posting things, but they're posting, kind of one resource here or one resource there, that is my thinking into thinking about being a hub, being a place where you consolidate that information for people so that you're not relying on them finding it in different places, but that they can find it all with you or with another organization that's willing to share that information. Did I lose my connection?
I hear you.
Okay.
I hear you.
But it sounds like we might have lost Anita.
Okay.
Sarah, can you?
I can ask another question while we're waiting for Anita to come. I think we still need, Dejan's question is, how do you connect with populations who are accustomed to high-touch communications and connect instead of high-tech? To the high-touch instead of high-tech?
Yeah, that's a great question. I think that in particular in places, I was problem solving with one of the states I work with around how do you get to the communities that don't have access to technology. And we were thinking that part of the way to get to those communities is sort of through the same avenues, but in more of written communication that goes into their homes rather than into groups. But I think to Michelle's point, using supermarkets and places that are still open and available for folks to be able to see messages is really helpful. And I do think that for families that are in crisis, experiencing crisis, the use of some, there's at least one state that uses some telehealth technology where they supply the telehealth technology to places that are that don't have access. That certainly I'm willing to talk with folks a little bit more about if they have questions.
Okay, we've got a comment from Jill Story from Jacksonville. Anita, it sounds like you're back. Do you want to take that one? Oop, maybe not. So Jill says that Jacksonville is a medical tourism city. And this weekend, she developed a pediatric SOC in a website or web page for the most up-to-date child health information for pediatricians and child-serving professionals. Sounds great. The page will be updated and emailed out daily. And my next step is to repackage that information for families and disseminate to community and parent partners. And she likes the idea of setting up Zoom calls and parent partners. And I think that that sounds great. And now is the time to use the online channels that are available to you, like this conversation. I mean, normally we do a formal webinar with slides, but I think people need to see each other right now. And it's also a strong way to let people know that you're there by having them actually see you and being able to answer their questions. Let's see. Annie says, is there a way that others could share their Facebook pages or websites so that we can borrow from one another of post ideas and wording? And she's also using Pinterest to give families ideas for everything from coping mechanisms to things to do at little to no cost while at home as a family. And they'd love for ideas to expand on this. And Liz, you had actually raised this. This is a challenging time, but it's also an opportunity because families are together for more time than they normally are. And so to really take advantage of that and consider resources that can help them.
Yeah, I was just going to actually add that, part of the challenge in the return to school and work is that disconnect, right? So when it's working well and families are together and they're working well together, they're, they're out walking, families around here all walk in, playing games, they're spending all of this time together. That's going to be challenging in terms of the disconnect when children go back to school, and part of what we have to worry about. We also have to worry right now that some families don't know how to do that and how to connect and how do we share those tools. So those are both challenges and opportunities for us to really help, I think, in terms of some of the stuff.
That's great. And if people want to post links to their Facebook pages or their web pages in the chat room, please do so. There's a few people who've written in. Nancy says she missed tip 4 and 5.
Sure, I didn't get to them. Bring us back on track, Nancy. Appreciate it. So number 4 is to remain forward, looking. And I think this is generally one of the things I think is important, no matter what you're working with or what you. It's an underlying value in building systems of care is that you're remaining forward looking. But when I talk about forward looking during this particular time, I'm talking about a couple things that are really important to be attentive to. One is to make sure you use the system of care values in order to continue to make decisions. And by that, I mean, we always consider the voice of families and what their experience is. We want to be attentive to the sense of urgency that families feel and figure out how we're going to solve some of the challenges they feel within the context of those urgencies. So those are the kind of things that we're thinking about, we're looking forward. But it's also about what happens when things start to go well, because that's generally when the second wave hits around the challenges around mental health issues. During Sandy, we really needed to be attentive to what we knew was going to be a challenge around the first thunderstorm and the first, a scary rain day, and all of the things that happen as just part of the course of time. And we built strategies into each one of the things that we were doing to make sure that we were attentive to what we knew was going to come, so that we could help children and families work through the traumatic experiences that have occurred. It's the same thing for us here. We need to really be attentive to that. It's like the forward thinking around the loss. And 5 is connect leaders and communicators, and make sure that those are the folks front and center. And I often talk about within systems of care, who's your translators, who speaks juvenile justice and child welfare, and we want to put those communicators front and center to make sure that there's no miscommunications during this period of time, that people really understand the basic level of communication. Language is so important within the context of this work, and so we want our best communicators out there really talking to folks about what's going on and what's happening.
Mm-hmm.
And we have another question from Dijon about how do you connect with populations who are accustomed to high touch communication and connect instead of high tech?
Okay, so I think we talked about this already, but
yeah, I think he just put it in again.
Yep, no problem.
Mhm.
Just a reminder, right? High touch means that we have to figure out how we're going to get to them on a regular basis. And let me just make one particular point. For those children with the most complex needs, during this period of time, they need high touch, and high touch can be lots of communication by phone. If you can use telehealth, that's great. If you can actually, if you have to, there are some strategies around engagement face-to-face without touching and recognizing social distancing challenges. So we really want to be thoughtful about those children who have the most complex needs.
And
Another question here from Wendy. It says, what is the recommendations or guidance for children split between 2 homes?
Sure. Boy, that's I'm going to say that is the basic social system of care value, and that is individualized planning, right? Every child needs to be considered, not just one plan for every family. And so we need to be really thoughtful about what's going on in each home, whether children have been exposed, whether the parents have been exposed. So there are medical considerations within the context of that work. There's also the actual considerations around what's in best interest of children. So hard to answer the question because I don't think that there's one answer for every single family in terms of how that's going to work. And we really, really need to have individualized conversations, I think, with families around what's in the best interest of children.
it also makes me think that this is a great example of how the kind of information that you're putting out may not necessarily be linked to your organizational goals. So for example, if you have families who are split in more than one household and need to communicate with each other electronically right now, I have seen stories online about parents struggling to do that, particularly with young children. And I haven't seen any information or tips about how do you engage a child digitally over line, but there's got to be some best practices and ideas out there. Or you could put together a list of software that people can use for free, like Zoom or other things. People are struggling even with, like using Skype or Facebook. There's a Facebook Messenger. There's a couple different ways that people might not think that they can talk to each other, and that you could provide information about that for them.
So this is Denise. Myra also has in the chat box, and it relates here. On the flip side of that, in her project, they have many families who do not have access to the internet or cell phones, or have cell phones with very limited minutes. And at the moment, they've lost contact with many of them, and that's their biggest concern. That's a tough one.
That is a tough one. I think one of the one of the things to think about, we were just working with one state around this, is is there a way for you to help support getting more minutes, right? Or get some of those technologies into the community. But I do think that there's going to need some real special thinking about how you're going to keep those families engaged. Do they have landlines, by the way? Is there, do they have access at all to a landline? And if they do, maybe conference call technology is the way to go about getting to them, right? I do think that this is the time of really trying to figure out how you're going to communicate with all of the individuals that you're currently responsible for.
Anita, I believe you are muted. Poor Anita has been in and out. Technology has been a challenge here as well. I think you're muted right now, Anita.
Sorry about that. I think I'm experiencing a little bit of a blackout over here. Our lights are going off and on, so I'm so sorry. Yes, so I don't know where we are with our questions, where we have any more coming up. Just want to make sure I covered everyone.
A great question is people are posting links to their resources and to their Facebook pages.
Yeah, that's awesome.
Consolidate them in a document and send it to them after this webinar.
Will do. Perfect.
Absolutely, we can do that. And Corey from NICWA is asking, yeah, she'd like a document so she can share it with tribal care communities. Likewise, Corey, if there are things from tribal communities that you can share with us, I often see some really innovative communications coming out of the system of care communities amongst tribes. That would be great.
Yeah. Just making sure we got all the questions covered. Anybody have any more questions they want to submit or ask at this time?
I would just go back up to that one comment from our colleague at Youth Move who posted, Matt.
Mm-hmm.
That he's putting together social media and blogging resources on that could be useful to all of us around working from home, self-care. Definitely, if you're not following Youth Move, now's a great time to do that. We were able to see a great picture of you, Matt, so thank you for that, and thanks for your recent blog post.
Yeah. And thank you, Amy, for sharing that you're doing a group on Zoom for families who have children under the umbrella of the Southeastern region. So thank you so much. That's going to be great. That's a great way to connect with people and families.
Jill is asking for the information about SAMHSA grantees. It was in the chat box at one point, Jill. We'll put it back in now.
Yes.
And we'll make sure that goes out to everybody who joined today's call. We'll also send to everybody the 5 tips document. Several of you have asked for that. We've reposted the chat box a few times, but we'll be sure to disseminate that as well. Also, if you'd like to join us again on Tuesday, we'll be sure to send that link. I'm sure with different participants and a few more days under our belt, we'll have additional information and discussion.
Absolutely.
Right.
Great. Well, thank you all so much for joining us. And you have Liz's address and my email address. Please do feel free to reach out. We're here and we'd love to help.
Absolutely. Absolutely.
Thanks for joining us today. And thank you for all the work you're doing for your communities. We appreciate you.
Stay safe and healthy.